I told you, first and foremost thing is to identify the hidden heart disease, which doesn't have any symptoms. Okay, so that we'll discuss separately. What are the screening methods, what is the most cost-effective method compared to the existing methods, what we have in traditional methods, which we have been inappropriately following for decades together. Now, a chest pain, as I said, in the person in the village, in the night, sometimes somebody gets more than 35 years or 40 years, he gets burning sensation in the pit of the stomach, in the center of the chest. It can be very light. There need not be any sweating. There need not be fall in the blood pressure. And most of the times it is in the center, but sometimes it can be only in the jaws. I've seen the patients going to the dentist, they extract the teeth because some teeth are loosened, but then it is a cardiac pain which is radiated to the jaw. And then it can go to the shoulder, left shoulder or right shoulder or back. I've seen many patients going to the orthopedicians who have received physiotherapy for the hand, and after a day or two, they come with a massive heart attack and enlargement. Unfortunately, apart from being 30% of patients or heart attacks being silent, people who have attack also, the symptoms are so masquerading, like, it is like a burning or a gastric trouble, number one. Number two, in women, in elderly, they can have just some sort of palpitation, or fatigue, some weakness, and or some sweating. And so many varied symptoms are there, and without chest pain, that is how many people also miss. So these are called angina equivalent. So when any patient, any person who did not have that feeling of palpitation or breathlessness or chest pain, which was not there and lasting more than 5, 10, 15 minutes, it should alert them. The ECG has to be taken, though in 45% we can miss, but at least in the clinical picture and a sensible physician will understand that this is likely to be cardiac and ECG can be fallacious. Let me wait and check. Now we have something like a troponin. Troponin I or troponin T, a cardiac enzyme, after an hour or 2 hours or 3 hours, definitely it will go up. So at least when a 35, 40-year-old person goes to a doctor, he should hold the person for at least 3 to 4 hours till he decides or there is clear proof that it is not cardiac. Many times, many people, the misinterpretation of the chest pain in US, unfortunately, 4% of the litigation, 4% of the time chest pain is misinterpreted, it is missed, and then it is the largest litigation amount that is paid by the doctors even in US. So that is why not to miss the diagnosis is very, very important, and high index of suspicion, being patient, not being dogmatic, not giving advices by telephone. When his patient phones, I am having burning, then don't tell, you gave Dizine. If it doesn't respond, then come here. No, absolutely no advice via telephone for chest pain patients. This is mandatory. American Heart Association says, no, don't talk about any remedies over phone.